Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Manitoba's case numbers, test positivity rate, healthcare system admission rates continue to trend in the right direction, which allows us to consider reopening more services cautiously and safely. This is the hard work and diligence of Manitobans that's paying off right now. We do have the variant of concern that we have to keep in mind. So it's crucial that Manitobans continue to follow the fundamentals, washing our hands, staying home when we're ill, even just mildly ill, getting tested even if we're mildly ill, self-isolating as appropriate, wearing a mask. These are all things that we're going to need to continue to do as we reopen things to ensure our numbers don't spike again. We need to continue to avoid those activities that are known to cause the greatest risk. These are crowded places, closed spaces, close contact settings. And so help us contain the spread of COVID-19 until we can further immunize more and more of our population moving forward. So given our current numbers today, I'm announcing proposed public health orders, order changes that are under consideration. These would be, again, under consideration for the entire province. These may not be made all at once, but will be used to guide orders in the weeks ahead. It's important to note that these changes would keep the province still under level red, critical. We still see transmission of the virus occurring. We do have variant of concern detected in Manitoba, and we still have people in our ICUs with COVID, so we still have to be quite cautious moving forward. All changes also include requirements to be following the fundamentals, such as the physical distancing and mask wearing. So these changes are going to be considered for implementation in 2 phases over a 6-week period based on public feedback. So they could go into effect as early as March 5 when these orders expire, and then again considered on March 26th. So I'm just going to outline some of the proposed specific changes. So if we look at things like our household and gatherings, things that we are considering is allowing households a choice of continuing to designate 2 visitors to their home, or designating a second household to visit each other. So as long as everyone in the house has authorized those designated individuals to visit. And so families would have to choose either that 2-person option or the additional household. Increasing gathering limits at outdoor places to 10 people, and this would include outdoor non-organized sport and other rec activities. Increasing the capacity size at places of worship for regular religious services to 25% capacity with a cap of 100 people, whichever is lower. For various businesses, we're going to shift the orders to, or consider shifting the orders to listing businesses that are required to be closed, and those would continue to be indoor theaters, indoor concert halls, casinos, and bingo halls. All other types of businesses would be able to operate with the precautions. We're proposing expanding the capacity limits for retail stores, malls, personal services to 50% capacity and keeping that cap of a 250-person max. So whichever is lower of those. And of course with those other public health measures still in effect. Expanding restaurants and licensed premises up to 50% capacity, but again with the requirements to only sit members of a same household. And as well as the other public health measures. Allowing businesses to resume operating video lottery terminals with physical distancing measures and or non-permeable barriers. Allowing professional theater groups, dance companies, symphonies, operas to resume rehearsals as long as these rehearsals are not accessible to members of the public. For things like recreation, indoor recreation, fitness, We are considering allowing day camps for children to operate, 25% capacity or maximum group size of 50. Allowing indoor recreation and sporting facilities, including gyms, fitness centers, rinks, courts, fields, ranges, studios, pools, to open up for individual use or group instruction. We would have practices only, training only at this point, public health measures in place, and then a capacity limit at 25%. Allowing dance, theater, music facilities to open up for individual instruction, but also group classes for, again, a total capacity of 25%. And that this would apply as well to gyms, fitness centers. Can continue with individual training or individual instruction, but also could return to group classes with a 25% capacity and other public health measures. Other indoor recreational facilities such as arcades, go-kart tracks, children's facilities would be open to 25% capacity. We're looking at outdoor amusement parks to be able to open at 50% capacity. Users of gyms, fitness centers, pools, not to wear a mask while taking part in that physical activity, but would be required to wear it in other aspects of the areas. So again, these are changes that are under consideration, and these are possible changes over the next couple iterations of orders over the next 6 weeks. And we're requesting again Manitobans' feedback on this to go to engagemb.ca to provide feedback. And we want that particular focus on deciding which services are most important to reopen at this point, while continuing to balance keeping transmission of the virus down. Feedback will be used to guide changes in the weeks ahead, though all these changes may not be made all at once. So we continue to be cautious in our approach. No one really wants us to reopen widely and then again have to go back and close things again. So we're going to do this very cautiously, ensure we don't increase the case numbers and we don't want to, again, burden the healthcare system. So we want to stay gradual reopen, but we want to stay open. And so Manitoba's adherence to these orders and these fundamentals will really decide our path forward. So thanks to everyone, and happy to take some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question this afternoon. And up first from CTV Winnipeg, Michelle.
Hi, Dr. Roussin. Just a question about the time period. So instead of doing it 3 weeks at a time, you're proposing a 6-week period with 2 phases. Why do this instead of what we were doing before?
Yeah, so this is just a proposal right now. So we're proposing, some or all of these changes. We'll look at the orders that expire next week and continue with our loosening plans. What we're saying is that it's likely that it would still be a 3-week evaluation of those orders. It's just that some, or all of these recommendations, may make it to the next iteration. They may make it to the 3 weeks following that. So we're just saying that these are open. These could all take place at once. They could all, some make it to the second iteration, and that's why we're talking about the 6-week period.
Okay. And a question regarding something else. Are Métis people going to be given priority access to the vaccine?
Yeah, you know what? That's a question that should be directed, to the vaccine task force. I know we've had some good working with the Métis Federation, so I'm going to direct that question to our vaccine task force.
From the Winnipeg Free Press, Kevin.
Hi, Dr. Roussin. While it's encouraging businesses are being allowed to further reopen, the public health doesn't seem to have provided concrete guidance for the restaurants for the implementation of the household rules. Could you give some more details of how they can do this? Because we know from so far that it puts a lot of onus on the restaurants to make sure they're in compliance with their patrons coming in.
Yeah, and so we realize nothing's going to be perfect as we roll these out. We know that where's the risk with this virus, right? Closed indoor places, prolonged contact, and that's why we see and have seen super spreader events. We've seen outbreaks related to restaurants. So for this to be successful at this point, we can't have multiple households seated at the same table for prolonged periods of time. We're going to go backwards. We're going to start reporting outbreaks and have to change things. So it's in everyone's interest to ensure we don't have multiple households seated at a table for prolonged periods. And so the exact mechanism for how that can be done, I don't think there is a perfect way. If we had to wait for a perfect way, then we wouldn't have been able to open restaurants. So what we want is everyone, Manitobans, business operators, to do whatever they can to ensure we don't have multiple households seated at a table. And we list that as reasonable measures. And so just like, so many restrictions or regulations, reasonableness is used, and there's, depending on the exact situation, we'll have to decide on whether that was reasonable or not. So I'd say this is in everyone's interest. Because if we start seeing outbreaks moving forward, in any of the facilities that we open up, we'll have to make changes and draw back some of the loosening. So, so my, advice is that we know it's not perfect, but I think there's reasonable measures that restaurants can do to try to do their best to ensure it's a single household seated at a table.
And I guess my other question would be, how confident are you in terms of that it seems that if all these openings were to take place after the public dialogue, that we would be back at just about, if not the same level we were at back earlier when we had just about everything open, and then our numbers went up dramatically. There are variants out there that say, how confident are you that we'll be able to continue going forward?
Well, we have to be cautious, and that's why these, every step of the way here in this, new year, we've taken a very cautious approach. And so even here, we have restaurants to 50% capacity, but we still put that quite a big burden out there that it can only be household members, because we know that if we just open things up right now to where we were in October, there's a significant risk that we start seeing November and December numbers. So we're just starting to get into spring. We're just nearing where we're starting to get more and more vaccine. So we're at a real important part right now of our pandemic, where we got to keep these numbers down. We have the numbers down, so we also have to try to get things open again. But we have to be very cautious.
From Global News, Joe.
Hi, Dr. Roussin. Just want to get some clarification on the gatherings, the indoor gatherings. So what exactly does this mean? You're allowed to have continue with having 2 designated visitors over or designate a second household. So that means if you cancel with your 2 designated people, you can now go back and choose 2 people from 2 different households. I'm just looking for some clarification here.
Yeah. So what we have in place right now is you could designate 2 people as your visitors to your household. And so if you want to stay with that, if that works best for you, you can. Meaning that those 2 people could be from different households. And so we think that if somebody had designated somebody who they want over as maybe lives alone, then forcing someone to say you must choose now a household, that would disadvantage them going forward. So if for whatever reason designating 2 people worked better for you, you can keep that. or moving forward right now, you could designate an entire household. So if there's another household, you have 6 in your household, and another household has 6, well, you could have all 6 of that household come visit your household now.
Gotcha. Okay, that makes sense. Thank you. And of all this whole list here, it's going to be in 2 phases. Do you know more or less? Do you have like an idea right now which ones will come on March 5th, and then which ones would be pushed until the 26th?
No, this is the whole purpose here. We're going to put this out. We're going to get some feedback, and we'll then review that and make an announcement next week on what the next iteration will look like, and then what's still going to be considered moving forward.
From the Brandon Sun, Colin.
Hi, Dr. Roussin. Recently in Prairie Mountain Health, since the end of February, we have had since the end of January, we've had below double-digit cases and some days where we've had no cases at all. Given that COVID is less severe in certain regions of the province, are you considering a targeted regional approach to any future rules that you're coming up with here?
I think we're going to still consider that when we're so restricted in some areas. We found, just like when we did this for the north, continued to have the north lockdown, we're going to see too much mobility. So as we loosen things up, as we're getting out of the restricted level, then perhaps we'll continue to look at a regional breakdown. Right now, the concern is if you had a region like Prairie Mountain Health that had significantly reduced restrictions, we would just see a lot of mobility going into that region from more lockdown regions, and then have a very concerning effect on that region. So for right now, we're going to consider the entire province the same, but for sure as we move forward, we'll always review the pros and cons of having a regional approach.
This is, let me rephrase. You and the province have asked for public feedback several times now when it comes to public health orders. How influential has the public's feedback been on your decision-making process around public health orders?
Well, I think it's, we always want to hear from Manitobans. I know that there was a, certainly back in our phase 4 reopening, there was a significant contribution at that time. You might recall we were going to lift travel restrictions and then decided against it because of very negative public feedback for it. These last number of iterations, from my review of the surveys, the majority of Manitobans have been on board with the recommendations. So, so I guess it's, certainly didn't change our approach because the majority of Manitobans were in agreement with where we were going.
From CJOB, Will.
Good afternoon, Doctor. Wondering, with the low numbers and trends we've had lately, would you say this means our present reopening has been going well, or are we still too early to see the results of that round of health orders?
Well, I think it's early to be conclusive. But we certainly haven't seen significant spikes in cases, so I think that's reassuring to us. I think that we're having, as each passing day goes on, we're getting more and more of the most vulnerable Manitobans vaccinated. So, so I think going forward, there's reason for hope, but there's also reason for caution, and so I think that's what these orders are trying to balance.
Great, thank you. I'm still reading through the orders here, so forgive me if this was explained already, but we were hearing a lot from parents who were a little bit upset that they had to send their children separately to certain, fitness classes or sporting events, those sorts of things. Does this change that at all?
So, one is these are just proposals. So for, details, there'll be more specifics coming out. But even with these orders, right, so we want to have for the indoor rec, we're proposing still 25% capacity, but lift any of the requirements we had before for individual training or one-on-one training. But we still want to respect the fundamentals. right? We don't, we want people to benefit from these activities. We don't want a bunch of people crowded in the stands. So we're going to have to be really cautious on how we manage that. But so all of these are that risk and benefit. So we want certainly the kids to be able to be active, but we're going to have to be very cautious. We don't want groups of spectators where a virus can be transmitted.
From the Winnipeg Sun, Scott.
Hey, Dr. Roussin, Scott Billick, Winnipeg Sun. Can you? I mean, I know you're wanting public consultation on this, of course, but are there any of these that you're leaning towards that would happen as soon as next Friday? And which ones may be a little more further off, something that you would be contemplating potentially for March 26th instead?
Yeah, I don't really have an answer for that. I would say that we're contemplating all of these right now. So, all of these we want feedback on and looking at, at them right now. Based on that feedback, based on, as we move into next week, we're going to be able to be in a position to have the specifics of what's on here. So we just wanted to, with this, you can see this is a quite a long list of reopenings. So this is certainly for this iteration of orders, this is the largest reopening we've done. So we wanted to have that option of a staged approach, but right now we haven't decided specifically on what's coming March 5th.
Thank you for that. You've been very cautious on places of worship in the past. Now I believe you're moving up to let's say about 25% or 100 people at whichever floor. I mean, that's a significant increase from what it is right now. What leads you to believe that that's safe, given how cautious you've been in the past about it?
Well, I mean, I think we still have to be very cautious, and I think it's a very incremental approach. We have, we have outbreaks that are linked to faith-based gatherings in our jurisdiction and pretty much every jurisdiction, and it has nothing to do with the operators or the people there. It has everything to do with the nature of this virus, right? Prolonged indoor contact, and so that's the nature. And so we want to be very cautious. We also want to know. We also want to, respect the importance of this taking place. As well as the hard work that a lot of these organizations have put into trying to make it safe for others. If we look at an analogy, the analogy as far as a risk-based thing for the virus, the analogy is indoor theaters, and so we haven't recommended those be open right now. So we wanted to ensure we're reflecting our low case numbers and that cautious reopening. But it's still just the nature of this virus makes it a high-risk situation.
From CBC Radio Canada, Matthew.
Hi, Dr. Roussin. Why there are no clear guidelines for wearing masks for children in daycare preschool?
Yeah, the mask. So, when we started having discussions about masks in schools, and making them mandatory. At first we had them highly recommended and we made them mandatory. There was always some arbitrary cutoff in most jurisdictions about the age where you make it mandatory, and most of that has to do with just the ability to comply. So at some age, the ability to comply with the proper use of a mask all day long dramatically deteriorates. So we had that at, our grade 4 level, thinking about kids in daycare at that age, wearing masks all day long. I don't think we're going to get very good adherence to that. So that's why we have that cutoff.
Thanks. I don't have follow-up questions.
From CBC Manitoba, Bart.
Hey, Dr. Roussin, I have about 400 questions on this, but I'm going to go to allowing indoor recreation and sporting facilities, that one. Outside, you've got a 10-person gathering limit. You don't have a limit here for indoor rec at 25%. Why not?
Well, we have like for for outdoor rec, organized rec is able to take place without a group size for the people who are taking part in it, and so inside we have a 25% capacity. With it, again, the public health measures, the group sizes, all that's going to apply to people who aren't immediately taking part in play. But we felt that the 25% capacity puts enough risk reduction in there.
Okay, a legalistic reading of that suggests that you could put roughly 3,750 people into Bell MTS place.
Right. So this is not the, this is for the indoor rec, right? So we're going to have limitations on spectators, right? So it's really a 25% capacity of a playing surface. And so again, these are just our proposals. When we come out with specifics, those are the type of things that we'll be, addressing in the orders.
Our final reporter this afternoon from the Canadian Press, Steve.
Oh, hi, Dr. Roussin. Regarding the indoor rec facilities and gyms and that sort of thing, has the science not informed us that there are very risky situations in terms of these group instruction, indoor gym classes and that sort of thing that you're looking at allowing? I'm thinking of, there was I believe, a spin cycle case in Toronto where that indoor heavy breathing closed environment was risky.
Well, yes, it is risky. There is risk involved with all these things, and we're weighing the benefit to that, the benefit to having businesses open, the benefit for people with physical activity. So so none of these are without risk. And so we want that 25% capacity to be utilized so that there is adequate spacing between participants. So we're going to have those, as we open these up, those type of guidelines. There's going to be strict enforcement of these things because it is risky. We need that spacing between people. We need screening. We need to ensure people aren't showing up with any symptoms at these places. So it's very cautious, and 25% capacity, I think gives us that ability to have people spaced out quite a bit.
Okay, and video lottery terminals is another big change in these proposed orders. When it says physical distancing measures and barriers in place, what does that mean? Does it mean a 25% opening limit for VLTs, or some specified distance between the machines?
Yeah, so the facility that's running it will have their 50% occupancy, so they'll have to abide by that as well as all the other issues that are listed. And then the VLTs themselves, they'll have to be either 2 meters apart, or there must be a non-permeable barrier between them.
And this concludes today's media briefing. Thank you.
Thanks, everyone.